I'm here with my friend Tim Fitzpatrick. Tim,
Hey.
how's it going?
Qasim, couldn't be better. Good to see you.
Tell the crowd about yourself, man. I know
Happy
there's
to.
no introduction needed, but go ahead, sir.
I disagree.
Yeah.
So I am Tim Fitzpatrick. You might know me from my newsletter called Signals from Space. Signals goes out to about 15,000 people in 50 countries, and we just talk about kidney innovation. So I think I'm in the right room.
Awesome, man. So, we're here at RPA. You see a lot of innovation happening, but what are the big trends you're seeing in kidney care that you can kind of comment to and tell us about?
Sure. Where to begin? I think I spend quite a bit of time thinking about the buckets of innovation. I think if I were to pick 4 broad categories, drugs, therapeutics. I think we've seen a lot of excitement around everything from GLP-1s that people have probably heard of to rare kidney diseases, IgA nephropathy, FSGS, lots of really cool new ways of thinking about treating these rare kidney diseases that have been overlooked traditionally, and great groups are here talking about the work and the research and the collaboration that's happening in that field.
Yeah.
I then think about something like devices, and in the device space, which has been at times pretty sleepy in kidney care and in dialysis and ESRD and AKI.
Yeah.
I spend a lot of time thinking about that one because we have devices that are opening up access, not just in your traditional outpatient dialysis center, but also think about the acute space, the inpatient space where you have really critically ill ICU patients and managing fluid overload and monitoring patients and multi-organ system failure and extracorporeal therapies that just haven't been done in the past. And then, oh, by the way, you have home patients, right? Home dialysis is a huge theme. And what if you had devices that were better able to serve a home patient population?
So you have new companies coming on the market with home, right? So
new companies and existing companies that are now thinking about getting home clearances.
Yeah.
Right. So if you can make the device simpler to use, obviously at the end of the day, it's a dialysis machine.
Yeah.
But there's still a lot of room for flexibility in prescriptions, and as you know, as a nephrologist who's had patients on home therapies, sometimes the machine can be a limiting factor or maybe overwhelming for patients.
And to your point, I think finally machines are paying attention to the UI and UX, the user experience and user interface.
Yep.
And so they don't, for the longest time, these machines looked antiquated, they looked hospital oriented, and now they're looking more like something you want to put in your house.
Yeah.
Right?
Devices is a exciting bucket, not just for dialysis purposes, but for continuous monitoring. You think about things like RPM and
wearables.
Wearables are
like
a fantastic example. Just think about
I got a wearable on right now.
You have a wearable on right now.
Yeah.
I have a wearable on. I think it's dead, so we had to figure out that that piece. I don't know if there's a solution for that yet.
Yeah.
But yeah, more data as long as it's actionable, intelligible,
100%.
and a clinician or a patient or a care partner can do something with that information, can act on it. Absolutely massive, a lot of excitement, but has some hurdles within kidney care in the U.S. specifically. Things like policy reimbursement have always been a challenge.
The bundle payment can always be
Yes,
absolutely.
it is the bane of the existence of a lot of course, first and foremost, patients.
Yeah.
But care delivery protocols, how do you pay for innovation is call it an existential question for a lot of companies.
What's the third bucket then? You had a third bucket.
So
Go for it.
third bucket.
Yeah, because
we've covered devices.
Device was a big bucket. Yeah.
Drugs, pharma.
Yeah.
Let's talk about policy.
Okay.
So policy, as you can imagine, right now we are at RPA 2025.
Yeah.
Mark your calendars. There is more uncertainty in the market today than there has been since the pandemic, right? So that's beyond nephrology, but it also in Washington there's a lot of uncertainty. I think people watching will have the benefit of hindsight to know how this shakes out. We do not. There are questions around things like FDA, around HRSA, which oversees transplantation. There's a modernization effort taking place. There has been some consolidation within Washington, within HHS. There's been downsizing of staff. These are, of course, challenges when it comes to thinking about stability and the environment within which we innovate, we deliver care, we think about what is the future of transplant, what is the future of dialysis innovation, how do you do that, how do you measure new payment models and bring innovation to things like value-based care or the next iteration of KCC. These are really big questions that the people in this room in this conference are trying to answer and need answers to. We don't know that yet. But of course I want to follow all of the policy levers that are happening as best I can. I'm not a policy background person, but there are some very smart people helping me think through it. But it's driving, it's enabling or blocking much of what we talk about in this room over the...
Fourth bucket, what you got, man?
Okay, maybe we wrap up talking about transplant.
Okay.
So transplant is its own animal. Puns half intended. Obviously, xeno is a huge theme and it has gotten people very excited.
Yeah, absolutely.
Understandably, it's an incredible feat of science and engineering and capital and all a combination of the right things at the right time. Many years into this, it has started happening lately because patients are receiving pig kidneys, genetically modified pig kidneys, from companies like United Therapeutics, Revivicor, and eGenesis, and hopefully more patients will continue to get access to those pig kidneys and pig organs. First one was just performed in China, first pig liver. So an incredibly exciting field within transplant, but you also have these other areas like the IOTA model. So we talked about policy. Part of that is this brand new fourth kidney-focused alternate payment model, APM, geared at transplant centers. So we have half the transplant centers in the country, 103, are going to be participating in a mandatory transplant-specific model starting July 1st of this year.
Okay.
That's a big deal. People are paying attention. This is a mandatory model. The second one, ETC, was the first one, which was just sunset, and that's another policy bucket thing. But transplant is having its moment. I think within transplant medicine, we're finally seeing focuses on increasing access through reducing the amount of discarded organs, increasing volume, capacity of programs to do more transplants, cutting down on the number of discards that are happening. There's too large amount of kidneys that are thrown away that are potentially
100%.
viable.
It's scary how many throw away.
It's scary, but also when you think about that, there's a balance there.
Yeah.
And there's which organs do we as a program are we willing to take on? KDPI wise, what is the risk of this organ? But then how are you going to build confidence around taking on riskier organs?
Yeah.
And how are you measured, right? Is it the 1 year outcome, or are we going to think about looking at a longer term horizon? So we've gotten very, very good, the transplant community, at delivering outcomes, safety and quality at the 1 year mark.
Yeah.
But what happens after that? And so I think we have some big questions to answer. Paying kidney donors is another really big, difficult thing.
Kind of an ethical thing, but
It's exactly. So as I say this, I know people will be flooding with their opinion. Anytime we talk about it, we write about it, we hear people are very, very passionate, understandably, about this topic. But you have to come up with a way to help address the shortage of available organs. So they're the right.
It's interesting. For the longest time, it was the artificial kidney. Now it's everyone's talking
about. Which is still a thing. But is further away. Than pig kidneys, which is kind of hard to imagine.
What I'm getting from you is, despite the uncertainty, there's a lot of positivity out there and things to look forward to. Is that what I would say?
That is my take. That is what I try to bring through my writing. But at the same time, need to acknowledge that there are a lot of really big question marks. Some of which I talked about. We need to know how we're going to pay for kidney care. I hear very frequently that people are the most optimistic they've been in their 20, 30, 40-year careers.
Oh, wow.
Because so many people are now realizing the importance of kidneys in primary care.
It's getting attention. It's finally getting attention. I think that's the big thing.
Yes.
Anyway, man, nice talking to you.
Always good catching up.
Take care, man. All right.
Thank you.